To connect with you again. This is Rebecca O'Brien and Dr. Alex DeMello, and we are Homeopathy United. We are joining you again on the Skin Conditions, Eczema, and Homeopathy page. And today we're going to talk about winter skin ailments, dry and cracked, which I think we are all experiencing. I don't know about you, Alex.
Mm-hmm. Well, some people are very susceptible to the cold and to, cold temperatures and to the combination of cold and water as well, that their hands get very dry and very cracked. And some other people really suffer from chronic conditions like eczema and psoriasis and other type of skin conditions long term that get very aggravated in winter. So
yeah, and it always amazes me because as a kid, it seemed like my mittens were always soaking wet, and I would come in and even working in the barn now, I come in and my gloves are all wet and everything. And then my hands dry up really bad. And sometimes my thumbs will crack or my heels will crack I think you're right. A lot of people deal with that just in general day to day. And I really feel bad for people that have, chronic skin conditions and they struggle with this type of thing. So we have some slides to share today to go over some remedies and talk a bit about this. So here we go. There's slide number one. I as soon as I saw this picture with the cracked heels, I was like, oh, I think everybody who deals with winter has experienced this or seen it or what have you.
yeah, and sometimes in the summer as well when
True.
you are barefoot, but it's a condition that can be very, very painful.
Yes.
Cracks are like, I don't know, well, cracks are cuts basically, and the pain can be very intense and very.
And it can be deep and it can be on the surface. Like this particular picture, the heels just look really dried out. The foot looks really dried out. And then you've got, somebody putting cream on their hands, which I think, we're all doing, any of us in the winter months. And then the dry skin in the background where some people struggle or deal with chronic dry skin. So when we talked about dry and cracked, I loved this when you looked up to see how many remedies there were for cracks in the winter.
Yeah, and to be honest with you, in the repertory, and I don't have the latest version. Maybe you will, because you
I
always
might have more.
you always read. On the version of the complete repertory, you have the latest, and I don't have the latest. But anyway, on my version, it's 15 remedies. I'm sure you will have more, but even if you have still 15 remedies, I believe that there are more than 15 remedies that are able to
That
address.
apply. Yeah. Yeah, absolutely.
But
And
the most important thing, and I cannot stop stressing this, you never, ever pick up a remedy
based on one symptom
alone.
Yeah. It's so important. And that's where we go back to the discussion that we've had, and we've shared this in a newsletter and also on the page quite a bit, that it's about the totality. And I loved your analogy, at the very least, 3 strong characteristic symptoms, the 3-legged stool. It's all about finding the balance. It's about finding those 3 major key components.
And when I say 3 minimum, because a stool cannot stand on 1 leg or 2 legs, it's going to fall. But so in order to have a bit of stability, you need at least 3 very strong symptoms. But sometimes even 3 are not enough. Now it's completely different, an acute situation. Again, we're going to go back to the same issue. If it is a condition that just happened a week ago, the temperature dropped, started snowing, you were outside, you were dealing with icy conditions, etc., and suddenly you have cracks, is one case scenario. Another scenario is if you suffer from eczema or psoriasis or any other type of skin condition that is chronic, that you have it for many, many months or for many, many years.
Right.
And three symptoms, it won't do anything. Will be as
No. You've got to go much deeper because there are a lot of other components at play here when we see people with psoriasis and eczema and other really severe chronic skin issues, diseases, however you want to identify that. The other piece when we talk about chronic is a lot of people think, and I think we talked about this last time, that, okay, well, I haven't had this for a year and it's just come back again. And it's a little different than it was last time. People will say, oh, this is an acute. I haven't had this for months. I haven't had it for a year or what have you. But is it a recurrent of symptom, or is it a chronic issue that it has periodicity, which means it shows up, could be every 3 months, could be every 6 months or once a year or whatever. There could be a very specific trigger, like you said, cold, wet weather, that sort of thing. But those still fall under chronic conditions.
Absolutely. Absolutely. And one thing that is a very good example is, for instance, asthma.
Yes.
Asthma, it's not permanent. And you might have an acute exacerbation, so an attack of asthma, and go 6 months without another one. Or the asthma, there are many types of asthma that are actually triggered by cold weather.
Yes.
As well. So you can be 6, 8 months without having an acute attack, and then suddenly in the winter comes. But that is a chronic situation.
Yes.
You suffer from asthma, even if it doesn't show. And it's the same thing with skin, although skin, there are many cases like asthma, but the majority are more or less permanent. I mean, if it's eczema, it's pretty much there.
So we've chosen 6 remedies to focus on today. And the first remedy, these are the 6, the cracks worse in winter, 6 of the 15 that you found. And so we have Sepia, Calcarb, Petroleum, Sulph, Psorinum, and Sulphur. And it's always fascinating to dig into these remedies under the guise of a new symptom picture, whether it's skin or lung or emotions or, there's just so many different ways that these can show up. Sepia, interestingly enough, we had 2 cases of influenza this past week, and sepia was the perfect remedy. In fact, there's a testimonial on our page, on our Homeopathy United page about that. So it's always very interesting. But today we're going to focus on cracks worse in winter. So let's talk a little bit about sepia.
So cracks worse in winter. I actually have a patient that suffers from eczema, severe eczema, mainly on her hands, and she's so bad that she cannot even wash her dishes, and she has a little baby, so you can imagine the distress of not being able to get into the kitchen and wash anything, not being able to wash the baby. Most of the people now don't use wipes to change nappies, etc., because of the chemicals that they have. So they prefer much more to use water and soap. But yeah, it's a problem. So, and she cannot even wear gloves because she sweats, and the moisture and humidity of the sweating also aggravates the cracks. So cracks worse in the winter for sepia, and she's a sepia case. cracks and fissures, worse for washing. And now, worse for washing, there are many remedies, but some of the most common are sulfur, antimonium crudum, Calcarea sulfurica, which we're going to talk today as well, and pulsatilla. The slightest friction aggravates the complaints. So we have to compare with oleander and sulfur. So the slightest friction, meaning when you undress, because when you undress, you're pulling out clothes, aggravates the skin condition, which focusing mainly on skin. Eruptions that the location can be all over the body, but usually is worse in the flexures. So this particular patient of mine, actually, although she had an eruption all over the hands and the hands very dry, etc., the cracks were much worse in between the fingers. So flexures, in between fingers, bends of the elbows, back of the knees, these sort of places.
Yeah, in between toes is also very common for cracks.
Absolutely.
You know,
And
especially in the winter.
You know, Psorinum, which we're going to talk today, Petroleum, Sulphur, graphitis, and mercury have, again, the location on flexures or folds of the skin.
Great. So let's take a look at petroleum. This picture that I found is somebody had dipped their hands in petroleum, and this is not the petroleum that the remedy is made out of, but I thought it was kind of perfect for you know, what we're talking about there are people that want to just immerse their hands in things like Vaseline, you know, some kind of substance that's going to make their hands feel a little bit of relief.
Yeah, Vaseline is a derivative of petroleum. And it's very interesting that usually petroleum cases, they get very aggravated with petroleum.
Topically.
And I remember a long time ago, actually, listening to one lecture of Hilary Dorian, she mentioned a case of petroleum, and it was a little boy which was suffering from a skin condition as well, eczema, and he would get much, much worse when he was outside. And then it dawned on her that the house where the boy was living was very nearby the airport. And with all the planes going up and down, when the kid was more exposed to the air, and of course, it has high concentrations of petroleum, he would aggravate tremendously. So, yeah.
Very interesting.
Cracks and fissures, again, like sepia and all these other remedies. So again, we cannot go on one symptom alone. Eruptions, again, on the folds, worse, the cracks are worse on the folds between the fingers or the toes. Cracks that bleed easily. So the cracks in petroleum, they are deep. You know, they are really deep, like the first photo that you had put in the slides. And again, comparative materia medica, silica has cracks that bleed easily. Condurango is a very good remedy for cracks that bleed. Nitric acid, another very big bleeding remedy. And I have had very good cases of deep cracks with sarsaparilla as well. And chamomilla. Think of chamomilla. I mean, people think of chamomilla for intense pain, anger, tantrums. You would never think of chamomilla, or, you know, it wouldn't come to your mind as the first remedy for cracks, deep cracks that bleed easily. And very, very dry skin. Petroleum will have a very, very dry skin.
Excellent. So the next one we're going to talk about is Psorinum. and this is actually a nosode. And the nosodes, Dr. Alex, give us your explanation of what a nosode is.
So the majority of our materia medica are made from natural substances, either from the animal kingdom or the plant kingdom or the
Minerals.
mineral kingdom. And most of the elements and combination of the elements of the periodic table, so the salts, are made into homeopathic remedies. Now, a nosode is something slightly different. So a nosode is an homeopathic remedy that is made from a diseased tissue. We have sarcodes, which is an homeopathic remedy made from an healthy tissue, but a nosode is made from a diseased tissue. So Psorinum is a very big and important nosode and is made from the discharge of a vesicle that was produced from an infection of scabies.
Mhm.
So people infected with scabies, they form vesicles, and these vesicles have a liquid, a discharge inside, and Psorinum is the homeopathic remedy made from that discharge.
And this Psorinum is such a phenomenal remedy for skin issues, which is one of the reasons why we decided to showcase it today. People these days don't tend to have issues. Like you don't see outbreaks of scabies the way that we did 40, 50 years ago, because people are, the hygiene is so much better. You might see it more in like a third world country or you know, that sort of thing. I remember an outbreak happening when I was really little, and it was because a dog in the neighborhood was gracious enough to share it with lots of kids that hung out with this dog all the time. But nowadays, it's not nearly as common as it used to be. But Psorinum for the skin, very dry skin with an offensive smell, like sulfur. And when you say like sulfur, do you mean sulfur smell or sulfur the remedy?
Sulphur the remedy. So
Okay.
both of these remedies, usually the skin has a dirty look, an unwashed look, and it can have a peculiar smell, not very pleasant, so an offensive smell. And both have the skin eruptions worse in winter. Psorinum is more addressed on constitution, so on the makeup of people that suffer from skin affections and glandular affections. So if you have a big, when your eczema flares up or when your psoriasis gets worse, you can also have glandular swellings, you know, being on the cervical nodes, on the inguinal. There is a kind of a relation of this, although they are different systems, they come in parallel, or they come together, concomitant to each other. The skin of Psorinum as well as sulfur is very dry, as we said, dirty looking, and Psorinum rarely sweats. And they are very chilly patients. We already said, you know, with bad odor. And there is a peculiarity in Psorinum, is that the skin can be very, very dry, or it can be very, very oily.
And so sulfur, which we've referenced quite a few times here already with different rubrics, is the next remedy that we're going to look at. And then we'll talk about the differences between Psorinum and sulfur. There's, again, the cracks and fissures after washing. We've seen that, you know, with the Sepia and the Petroleum. And And then there will be a couple of other remedies that we cover in a moment that also have this. And then eruptions of almost every kind, dry, rough, wrinkled, scaly, burning, itching, violent. Sulphur, it's one of the first remedies that I think about. It's not necessarily the first one I reach for, but it's one of the first ones I think about when I see a person or an animal having a skin eruption.
Yeah, because the thing is that the Psorinum is the nosal for Psora, and sulfur is the #1 remedy that is antipsoric. So the two and two, the two remedies go hand in hand. They are very related to each other. And sulfur being a huge polycrest, being a huge psoric remedy, it covers almost any kind of skin eruption. Now, it has a characteristic that it is worse at night and worse with the heat of the bed. So if the skin condition is itching, the patient will be scratching all night, because in bed you are warm, and under the covers you warm up, your body warms up, and sulfur is highly aggravated by heat.
By heat.
Yeah. So
and scratching until it bleeds, having unhealthy skin and having sores that get infected and won't heal. We had done a discussion, a broadcast on lumps and bumps, which was actually about sores and boils and things of that nature. And I think we talk about sulfur in that as well.
So yeah, the thing is that the itching of sulfur is so intense, is so violent, that the patient really
It can't stop.
Can't stop, and it goes until it bleeds. And then, of course, it is very important that if it is a child, and even for an adult, please cut your nails as short as possible. It will stop you from scratching, but it will stop from
as much damage, doing as much damage,
spreading infection. Because underneath the nails there is a lot, but there are a lot of bacteria.
Yeah, very dirty. Even when you have really clean hands, you still have a lot of stuff going on under the nails. And we talked about that with the impetigo a couple of weeks ago, as well as, trimming the nails really short.
And of course, the other characteristic of sulfur is that the patient will scratch, and then when they stop scratching, there is a massive burning sensation. So it's
another keynote.
It's another keynote of sulfur. Very dry skin, like oleander and many other.
Some comparison of the Psorinum versus sulfur, like really understanding what one do you reach for first. Dr. Alex did a great job in doing kind of an outline to give you a clear picture. So the common symptoms of both remedies that we've just covered: the skin is very dry. There is an odor, and it is offensive. There's an unwashed appearance. It may be somebody that only takes a shower once a week, or has really greasy hair, or just looks dirty. Their skin can look dirty. It may be a case that they work in an industry where they're things get stained. They might be a mechanic, they could be an HVAC, they could be in a lot of different things where their hands are in a lot of stuff. But it may just be a case they could be an office worker and still have unwashed appearance of the skin. So those are all common symptoms. But Alex, talk a little bit about these differences, because they're really key to determining which remedy you want to go with.
Yes, so very, very nice what you stressed out. I actually had a case of a horse that needed Psorinum, and the owner said, it had lots of skin issues. It had actually as well some glandular swelling. I said, no matter how many times I brush him and I wash him, he always looks a mess. He always looks dirty. So it goes for people, it goes for animals. So Psorinum is cold, is chilly, and there is no burning. With sulfur, there is almost always burning. Sulfur is a hot patient. They are warm and they are aggravated by warmth. And usually on the skin conditions, even if there is no burning, as I said before, they scratch, scratch, scratch if there is itching, and the burning comes afterwards. So with sulfur is more itching and burning. In Psorinum, there is no burning. Itching will be present, but no burning. Sulfur is better by cold. Psorinum is worse by cold because one is warm, the other is a chilly patient. Sulfur skin is more red. There is more redness. There is more, the inflammation is, it has a much more reddish discoloration. And of course, if there is burning, usually the two go hand in hand. While in Psorinum, there are more crusts. In sulfur, there are almost no crusts. If you have crusts, it's not sulfur. And as I said, one is hot, 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 and the other is chilly, chilly, chilly.
Right.
So, although there are a lot of symptoms in common between the two remedies,
This really helps you to dial in.
Symptoms to help differentiate them.
Yeah. And then the next remedy that we're going to talk about is sulph, calcium sulfate, or gypsum, as anybody that has done any work on their house, they kind of know gypsum from the drywall days, that sort of thing. Again, cracks and fissures after washing. So we're back to that symptom again. That's a very common symptom. And it could also be just after getting wet, whether you're outside and your boots get full of snow, or your feet get wet, or your hands, your gloves get soaking wet, and then the cracks and fissures show up. The Sepia pulsatilla is another one. Carb, which we'll talk about in a second. Again, sulfur, brustox, and sarsaparilla was another one that you had referenced as well for that particular symptom. Talk a little bit about the eruptions on hairy parts. That's interesting that it would also be except the scalp, not on the head. And is this more of a chronic thing?
So it can have both. It can have on the scalp, and it can have in all the hairy parts of the body except the scalp. It's quite characteristic with dogs that you see, eruptions all over the body, but the head, it's quite okay compared to the rest of the body. And if we think about Calcarea, which we're gonna talk in a bit, it's a big remedy for cradle cap in babies, which again are crusty, very thick crusts on the scalp. So calc sulph, because half of it is a component of calc carb, it has eruptions either all over the body, but not on the scalp. And this is a keynote. It's a peculiar, because common thing is if you have all over the body in the parts with hair, you would have it on the scalp as well. the cracks and there is a lot of cracking and itching at orifices. So you can have cracks in the anus, for instance, along with itching on calc sulph. So it can be cracks on the nose, on the nostrils. It can be cracks even on the ears. There was, I had a case where the patient had ear infections and the ear was very red, and there were cracks as well on the meatus, right on the entrance of the hole of the ears. So this is a characteristic of calc sulph. But of course, there are other remedies that also have itching and cracks at the orifices, a very dry skin, and calc sulph, again, if you scratch and you have sores, they will be hard to heal. And usually if there is a discharge, it will be yellow. There is a yellowness of discharges.
Great.
Calc sulph, because again, it's going to be quite similar to calc carb.
Calc, right,
Half
calc
of
carb. Yeah, it's a combination of calc carb and sulfur. So you're going to see
exactly.
you're going to see an overlap of those two. And then our last remedy is calc carb. This is a very common remedy. Pretty much anybody, it's right up there with like arnica and aconite, Hepsulph, calc carb. There are several remedies that people have used at one point or another, and calc carb is definitely one of them. The middle layer of an oyster shell, which I think is just fascinating when you think about the way that an oyster develops and how it takes an aggravation for them to create a pearl, right? So it starts out as something that's an irritant, and you see a lot of irritant with calc carb. Again, the cracks and fissures in the winter. This is one of the top 15. The eruptions on the hairy parts, like you were just saying, with several other remedies, clematis, rust hawk, sulphur, vinca. Is it vinca vine?
Yeah.
Petroleum and Napmure. And then we're back to cracks and fissures after washing, with that list of remedies. But milk aggravates with calc carb. Talk a little bit about that.
So you see, depends on what the chief complaint is in the patient, but if it is skin eruptions, it's quite noticeable that they get worse after dairy, especially cow's milk. And again, this is quite important because it will help us to differentiate from calc sulph. Calc sulph does not have this strong milk aggravation like calc carb has. Other remedies have it. It's not just exclusive to calc carb, but yes, this is an important factor. Or if they suffer, because calc carb is quite a constitutional remedy. It's a very deep acting, slow acting, but very deep acting remedy. And it's big in children as well as in adults, but children quite a lot. And therefore, if it is recurrent ear infections, they will have ice cream or they will drink a glass of milk, and then the ear infection will pop up. And there is a triad of symptoms, and usually calc carb is, it has a tendency to obesity. They are quite chubby and they are chilly, very cold. And this is again what you see on the whole, you see on the parts. So in the skin, there is, if you touch, it might even look red, but if you touch the skin eruption, it feels cold, and there is a sensation of coldness in the skin as well, which is quite characteristic of calc carb, and you don't have that in calc sulph because, again, sulfur is hot, hot, hot. So calc sulph is not going to be as chilly or not even chilly, you know, compared with Calcarea carbonica.
And
Yeah, this sensation of coldness is also very characteristic on the skin, is characteristic of Ruxtox and Causticum.
And causticum, yeah, that's what I was just going to ask, which is interesting because I think of causticum as like a sunburn remedy. And
It's caustic soda, it burns. That's
yeah,
why it's caustic. But it has sensation of cold.
of
Not,
cold.
but yeah, a strange, rare, and peculiar symptom.
Right,
as
right.
well.
That's a great
Sound.
example of that. Yeah, great example of that. And then we wanted to suggest a few tissue salts that are very supportive. Silica is fantastic. It conditions the skin. It conditions connective tissue. It cleanses the blood. It strengthens hair and nails. It's silica it's in all the plants. It's in, you know, it's the thing that keeps the connective tissue strong in our body, in nature, etc. And so silica is a wonderful tissue salt. Talk a little bit about Nat Muir and how the tissue salt works with regard to that, Dr. Alex.
So these tissue salts are amazing because you don't need to go through the symptoms. If you have skin complaints, you can use these 3 tissue salts, which on a physiological level will really help. Of course, they are, you need to use them at least 3 times a day
For them
because
to be effective, yeah.
they contain material doses. So we do not recommend to put them in water, and succussion does not count, because when you take, if in the flask, according to the manufacturer, says 2 pills a day, you want to put that amount of silica in your body.
Right.
And you need to repeat it at least 2-3 times a day. So if you dilute it,
you don't get the same effect from it.
Definitely not. So Natrium muriaticum is very good to balance the water, the body fluids in the metabolism. So think about salt. We use salt, you know, salt is very drying. And the nat Muir has the ability of compensate. So it reduces the water retention as well. So
Yeah,
it's
the edema. Sure.
and the edema, and most skin conditions, they have they have dryness of the skin. The nat Muir will not dry it even more. The nat Muir will just balance that the water, the moisture in the body. Aids digestion, aids eczema, of course. And then calc sulph. Now it is the same, but this is not homeopathic. A tissue salt is the Calcarea sulfurica that we talked before, but in material doses. So it's almost like a homeopathic vitamin. And because calc sulph has a lot of pus and discharges, it purifies the blood, reduces infection, aids skin disorders such as acne, and especially acne that has pustules, and it's purulent acne with pus. And it's very good to prevent sore throats and colds as well.
Yeah, and the tissue salts, the nice thing about them is there's just a new article that came out through Homeopathy, and they were talking about how If you need tissue salts, if you need to rebuild your system, this is a wonderful way to do it. And it's all natural. You're not going to have any side effects. And you really can't overdose on these, which is great. You know, a lot of times when we take a case, we'll say to somebody, we want you to take this homeopathic remedy, but we only want you to take it like once a week for 3 weeks. And then we want you to follow up with us and let us know how it's worked. The remedies work at a much deeper level. The tissue salts are really just about supporting the body, you know, strengthening some of the, what's the word I'm looking for? The strengthening the body on the whole, whereas remedies go much deeper and they work on mind, body, and spirit. So you're going to have a very different effect from the tissue salts compared to the remedies. Replenishing, that's the word I was looking for. And then we just wanted to touch really quickly, you know, when our hands get dry, when our feet get dry, when our legs are dry, we come out of the shower, we feel, you know, like we have dragon skin. One of the wonderful options is calendula cream, and they do make it in a homeopathic potency. It's like a 3x or a 6x. It's a very, very low potency, which is perfect for topical. It does promote healing. You use it on lots of different things, minor burns, blisters. You obviously don't want to use a cream on an open wound, but for cracked heels, chapped lips, nasal irritations, that sort of thing. This cream is fantastic. It's wonderful for sunburns, but you don't necessarily get those. Although I will say, my husband has managed to get a sunburn in the middle of February by being on the tractor all day, plowing the driveway, and came in with a really bright red face. So this is where calendula would really come in handy. But this is a good thing to have on hand, you know, 12 months out of the year, not just for the winter or the summer. And then we often talk about herbs when we're doing our newsletters. So I thought I would pop this in there because this is such a nice time of year. It gets darker earlier. We're kind of slowing down a little bit more sooner, you know, or earlier in the evening. And it's a great time to do an herbal foot bath. Calendula, lavender, comfrey, some Epsom salt. You can combine all the herbs. You can put them in like a tea bag or a muslin bag and let them soak, or you can do what I do, which is to just dump them in with the water and put my feet directly in there. And there's a lot of different versions of foot baths that you can look up online for herbal foot baths, but this is a great, really basic, simple recipe. And when you're done soaking for 20 minutes or however long you can manage to sit still and make that happen, it's a good time to exfoliate. Just taking a washcloth and, you know, scrubbing the feet and kind of getting some of the dead tissue off, not digging and scratching into it, but just scrubbing some of it off, and then moisturizing. And you can use the calendula cream or calendula oil or something to that effect. So, and it's a nice treat. It's a nice way to treat yourself too.
Mm-hmm.
So we want to thank everybody. We so enjoy doing these live broadcasts, and we hope that you have found some information on remedies, on these particular remedies that you weren't familiar with, and walk away with some new information. And we hope that everyone is finding some relief in the winter months, the dry months. And if you do have a case of something that has been flaring up that you've been struggling with for months or years, or, you know, every winter this happens, please feel free to reach out and connect with us. This is the best way to get in touch with us. And please continue to follow. We hope you'll join us in a couple of weeks. We'll be into February then, and we'll have another video to share. So thank you, Dr. Alex, for all of your wisdom.
Thank you, Rebecca,
You're
for
fantastic.
everything. Come on. And I also want to say that if you have any question about remedies relating to this topic, or something that you didn't understand, or you got a bit confused, just pop it in the group. We will be more than pleased to help.
Yes, happy to respond to comments or questions or what have you. And you know, when you have things pop up that you want to ask questions about, if it's a very specific thing that is impacting you or a family member, we do have an acute chart to go by that will guide you to give us some more information. And we may come back with more questions and inquiries and let you know what some recommendations are. So we look forward to hearing from everybody. Thank you. Bye, Dr. Alex.
Bye, Rebecca. All the best.
Have a great day.
And happy full moon.
Happy full moon.